When you hear of plastic surgery, what do you think of? So why plastic surgery is very popular, especially in this generation. Plastic surgery is a way to improve the way you feel about yourself. It's risen in popularity because people want to feel good about the image of their body and create a more physically high-appealing look. Lots of images may come to mind when you think of plastic surgery. But is plastic surgery safe? Complications of face surgery are infrequent, and cosmetic procedures are generally safe, as long as they are carried out by a qualified and experienced professional. But what if your surgery gone wrong? Is there a possible effect for it? Well, in short answer, yes. And that's what we're gonna talking about. But if you are new in this channel, don't forget to subscribe and click the notification bell button for more update. Well, let's start. Here are the possible effect of plastic surgery when it's gone wrong. Number 1. Hematoma. Hematoma is generally defined as a collection of blood outside of blood vessels. Most commonly, hematomas are caused by an injury to the wall of a blood vessel, prompting blood to seep out of the blood vessel into the surrounding tissues. A hematoma can result from an injury to any type of blood vessel, artery, vein, or small capillary. A hematoma usually describes bleeding which has more or less clotted, whereas a hemorrhage signifies active, ongoing bleeding. Hematoma is a risk in nearly all surgeries. Treatment sometimes includes additional operations to drain the blood if the collection of blood is large or growing rapidly. This may require another procedure in the operating room and sometimes additional anesthetic. Number 2. Seroma. Seroma is a condition that occurs when serum, or sterile body fluid, pools beneath the surface of the skin, resulting in swelling and sometimes pain. This can occur after any surgery, and it's the most common complication following a tummy tuck, occurring in 15 to 30% of patients. Because seromas can become infected, they're often drained with a needle. This effectively removes them, although there's a chance of recurrence. Number 3. Blood loss. As with any surgery, some blood loss is expected. However, uncontrolled blood loss can lead to a drop in blood pressure with potentially deadly outcomes. Blood loss can happen while on the operating table, but also internally, after surgery. Hematoma is a pocket of blood that resembles a large, painful bruise. It occurs in 1% of breast augmentation procedures. It's also the most common complication. 4. Infection. Though postoperative care includes steps to reduce the risk of infection, it remains one of the more common complications of plastic surgery. For instance, infections occur in 1.1 to 2.5% trusted source of people who undergo breast augmentation. The skin infection cellulitis may occur after surgery. In some cases, infections can be internal and severe, requiring intravenous antibiotics. 5. Nerve damage. The potential for nerve damage is present in many different types of surgical procedures. Numbness and tingling are common after plastic surgery and can be signs of nerve damage. Most often the nerve damage is temporary, but in some cases it can be permanent. Most women experience a change in sensitivity after breast augmentation surgery, and 15% experience permanent changes in nipple sensation. Number 6. Deep vein thrombosis and pulmonary embolism. Deep vein thrombosis (DVT) is a condition where blood clots form in deep veins, usually in the leg. When these clots break off and travel to the lungs, it's known as pulmonary embolism (PE). These complications are relatively uncommon, affecting only 0.09% of all patients undergoing plastic surgery. However, these clots can be fatal. Number 7. Organ damage. Organ damage usually refers to damage occurring in major organs fed by the circulatory system, heart, kidneys, brain, eyes, which can sustain damage due to uncontrolled hypertension, hypotension, or hypovolemia. Number 8. Scarring. Surgery typically results in some scarring. Since cosmetic surgery seeks to improve the way you look, scars can be particularly troubling. Hypertrophic scarring, for instance, is an abnormally red and thick raised scar. Along with smooth, hard keloid scars, it occurs in 1.0 to 3.7% of tummy tucks. Number 9. General appearance dissatisfaction. Most people are satisfied with their postoperative outcomes, and research suggests most women are satisfied with breast augmentation surgery. But disappointment with the results is a real possibility. People who undergo breast surgery may experience contouring or asymmetry problems, while those undergoing facial surgeries could simply not like the result. Number 10. Complications of anesthesia. Anesthesia is the use of medication to make you unconscious. It allows patients to undergo surgery without feeling the procedure. General anesthesia can sometimes lead to complications. These include lung infections, stroke, heart attacks, and death. Anesthesia awareness, or waking up in the middle of surgery, is very rare but also possible. And that's all for today. Thanks for watching.